name is Melissa Berry, and I'm the founder of Cancer Fashionista. I help women look and feel their best throughout their breast cancer journey and beyond. And I'm super excited because I'm here today with Dr. Awosogba, and she is the assistant professor at the Department of Psychiatry at UT Southwestern Medical Center and director of behavioral health and hematology and oncology outpatient at Parkland Health and Hospital System. Whoa, important lady. Thank you so much for joining us. And, if I think before we get started, if you can share, tell us really what is your expertise in the field of psychology, because it is so unique.
Sure. Thank you again for having me, Melissa. And yeah, so the specialty that I focus on is health psychology, and that is looking at how one copes with different medical conditions, and in this case, cancer. And when I do my work with patients, I'm focusing on various aspects of emotional distress, including anxiety, depression, post-traumatic stress, related symptoms, as well as body image issues, and some things related to grief and loss. And so that is really kind of my focus in the work that I do, and helping people achieve the most optimal quality of life that they can have in the midst of coping with different medical conditions. And so with that being said, as we continue, I just want to put out there that what I share are views of my own and do not reflect that of the institutions that I work for, and that I really strongly advise for anyone who is experiencing different symptoms or distress that they seek professional help.
Wonderful. Well, thank you so much for joining us. And you are truly so unique. And I wish I had you at my side when I was going through treatment, because I think that, going through, an illness, there are so many components and things that, play into our mental state of health. So thank you for combining these two worlds and helping so many. So I think I'd love to just dive in and start quizzing you.
Yeah, let's do it.
So, what are some tips you can share in regards to managing chemo brain?
Yeah, that is a common thing that happens, unfortunately, with chemotherapy. And I would say it's not even just restricted to chemotherapy, but people can have changes in their cognitive functioning and the way that their brain is working related to different treatments. But oftentimes people do use this term chemo brain to talk about somewhat of like a mental fog or cloudiness. And the symptoms may look like some mild forgetfulness. Like, for example, you may place something somewhere and then within seconds or minutes, you forget where you placed it. Word finding difficulties of familiar words. It's like on the tip of your tongue and you just can't get it out.
Or walking into a room and having no idea why you're there? Or is that just what losing children does to you?
That can be a different issue. But another way in which chemo brain may present itself is concentration issues. You just can't find yourself being able to focus, especially maybe when you're reading something. You're reading the same thing over and over and you can't seem to absorb the information, watching television, things like that. And another thing is multitasking. It is hard to multitask because, again, with the forgetfulness, you start doing one thing, you forget about the other thing, and then, and that can be a bit dangerous if certain things are involved, like cooking.
I'm sadly familiar. It's like, oh, what's burning? Oh, I was toasting a bagel, and now I'm doing something completely different. So,
and it ends up being burnt, and you wasted bagel.
The worst part.
Yeah. So keeping in mind that the brain is a muscle. It's like any other muscle. You need to exercise it. So some of the things that you can do to exercise your brain is to work on different puzzles, learn a new hobby, something that kind of activates your brain, because we can tend to be on autopilot, if you know what I mean. We go from one place to the other pretty frequently, and we don't even know the, you know, the time in which we got there and what happened. We just kind of ended up at our destination. So we oftentimes do a lot of things on autopilot. So incorporating something new, not too challenging, into your world, like a new hobby, puzzles, things like that, that may actually be stimulating for your brain and working out that muscle. Other tips may include some simple strategies, and this is really not just for chemo brain, anyone in general, but definitely helps with chemo brain, is daily to-do lists. You know, keeping track of what you have going on, because we can be overwhelmed pretty quickly. Avoid multitasking. It is okay to do one thing at a time. Focus on just that one thing at a time and really try to avoid, refrain from doing multiple things at one time.
I think it's a
Avoid,
really good, I'm sorry to interrupt you. I think it's a
yeah,
great takeaway. I think especially when you're going through chemo, you are trying so hard to stay on top of everything. And I think, you need to you probably agree, you need to strike a delicate balance between, not overwhelming yourself with so many tasks in a given day, but on top of that, like, basically putting a to-do list that's realistic so that you're
yes.
not overwhelming yourself. And that could lead to anxiety and depression.
Yes, and Melissa, you have it right, that it's realistic. You want to make sure that these tasks that you're putting on there, if they seem too big, break them down into smaller steps so you feel like they're manageable. So that's another part of it. Avoid distractions, and that kind of goes with the multitasking and being easily distracted, is to avoid the distractions. Try, especially if it's an important task, to put your phone on silent. Avoid having to attend to emails and all these other things that can so easily get all of us distracted. Give yourself that time and that space to just focus on that one thing. And then put sticky notes up. This kind of goes with the to-do list, but if you have sticky notes, use your smartphone. It has many different apps on there, or just an alarm setting to remind yourself of things throughout the day. So there's quite a number of things that you can do.
Great, thank you. I wish again that I had those tips because they're all great, and I think they're great even today with all that's going on, and everyone's seriously multitasking. Homeschooling while they're trying to do their jobs at home. So these are great tips for anybody. So thank you for
Yeah.
those.
One more thing
Um,
that actually, sorry, Melissa, one more thing
no,
that actually comes to mind when I think about it too, is that I do oftentimes ask folks if they pay attention to caffeine and other substances that might impact their mental acuity. So also pay attention to the time of the day where you tend to do your best work, as well as any substances, including caffeine, and other things that you might eat that can cause you to slow down or pick up.
Exactly. Great tips. Thank you so much for those.
Sure.
So we could probably do a whole webinar on chemo brain. Thank you for that. So on to the next question. How do you tell your young or older children about your diagnosis? Your children in general. What's the best way to communicate? I guess it really depends on the age, right?
Absolutely, absolutely. I would say just kind of in general, first off, when deciding to share the news with anyone in your support system, I'll start there and kind of work to the younger children and older children. So first, it's important to decide beforehand who you want to share the news with. How far do you want, what's going on with you to go? And this kind of helps because when you start to share the news with one person, you can let him or her know the extent to which you are wanting to share, what's happening with you. And emotions can be high when you're sharing the news with others. And so, especially adults, I'm kind of talking about adults and kind of working my way down.
Got it.
You want to stick to the facts. Just kind of let them know, explain the type of cancer, explain the treatment that might be needed, explain maybe the outlook, AKA the prognosis, and just kind of work your way around the facts and kind of talk through that. Be ready for this question. Is there anything I can do to help? Know beforehand that people are going to ask you how they can help. that's something to be expected from loved ones. And so it is important to kind of accept that idea and be comfortable with receiving help. We can't go at
Oh, 'cause I was like, wait, I don't know if my kids would be asking me that. We were talking about kids, but you're saying in general.
yes, and you know, I would include
I
kids.
don't know if that's the first thing they would ask. I love my children, but I just, yeah.
I mean, it may not happen in the moment where you share the news with them, but I think in the back of their mind, when they see you maybe struggling with some
Yeah.
things, they may come to you and say, you know, mommy, can I help? What, you know, do you need any help with
Yeah, sure. No, absolutely. No,
that?
like from my own personal experience, my children were, they were younger. They were, like 8 and 12. And I think that, I tried to really break it down in such a way. I was actually um, told to answer, give them a little bit of information, let them ask questions.
Mm-hmm.
Do you agree with that strategy? So, I
Absolutely,
mean, I
absolutely.
basically didn't want to scare them. I said, mommy has breast cancer, and I'm gonna take medicine that will make my hair fall out. I wanted them to not be afraid of the fact that I would be losing my hair, and to sort of preempt that whole situation. And it worked. And again, I think it depends on the age and it depends on the kids. And I think you
Mm-hmm.
just probably have to follow your instincts a little bit. But do you
Yeah.
think that's a good way to deal with it, is just to sort of drop the seeds and then let them ask?
Absolutely. So, you know, let me kind of just go straight to the younger children now, kind of after talking about generally. Yeah, when it comes to young children, especially the younger they are, the more the simpler you want to make the information. You don't want to give them too much. But I think basic information about what's going on with you would include the name of your cancer. And again, you don't have to get into the detailed, you know, medical term for it, but just the basic name of the cancer, where it is in your body, how it will be treated. And like you said, you can use words in terms like, mommy will be taking medication that will make her hair fall out. Whereas with your older children, they may want more detail, right? So
Exactly.
they've heard of chemo probably. They know from maybe other friends and peers and about cancer. So they may want to know detail. Okay, are you having surgery? Are you having chemo? Are you having radiation? And then lastly, of the basic information you want to share, no matter what the child's age, is how their lives will be impacted. You kind of want to give that some thought because that's some of what is part of the anxiety when they hear this news. In addition to that big question, are you going to die? That's a question I think to anticipate as well. And even if you are not asked that question directly, I think you should address it anyway. You should rehearse telling your children about uh, the, the, the treatment outcomes and the possibilities, what it might look like. So you may consider,
Right.
for example, saying something along the lines of, you know, before cancer, people had a lot of issues that they came to find out was cancer, but at that time they didn't really know how to treat it or they didn't have much treatment. But now so much has happened and there are a lot of treatments that are available and people are living longer with cancer. Some cancers are even curable. And even for those that are not, they're taking the medication and you're able to continue to have your life and live long. And so that's something that you want to just address when asked the question, are you going to die? Let them know if you've been told by your doctor, hey, you may have a good prognosis here. The treatment outcomes, we tend to have a good success rate with curing it, cancer remission. You want to share that with them. If you already have an idea that there may be a poor prognosis or it's a rare form of cancer, then you kind of maybe just want to stick with stating that you're uncertain at this point how things will turn out, but you're going to do your best to fight it and you will keep them updated as things change. So that kind of reassurance.
Excellent. You really covered so many areas. And look, there's never a perfect time or way to share this news because, of course, it creates anxiety for the family and fear. But I think these are all great ways to at least start the conversation and then keep the lines of communication open as the patient progresses through their treatment. So
Yeah.
thank you so much for sharing your wonderful advice. I wish we all had you in our pocket. Fantastic, really. Uh, so moving on, what are some tips that you can offer about feeling stress and anxiety before each doctor's appointment? And I think I'm 7 years out. That feeling never goes away. So, and look, there are different appointments and there's different stages. You know, uh, they're all different and different levels of stress. That's really my point. So, what tips can you offer when you're maybe you're about to go to a doctor's appointment and you're really afraid?
Yeah, so just in general, when talking about stress and anxiety, particularly anxiety, just the idea that anxiety is dealing with uncertainty. It's future oriented, and it is normal for us to think about the future. Where anxiety becomes an issue and quite stressful is when you tend to get stuck in that future thinking. And so really we're working on getting unstuck. We're not really working our way through eliminating anxiety, because you do want to think about the future, but not being stuck there. And so some things that you can do to really kind of bring yourself back to the present is what these strategies tend to focus on. And that includes things like deep breathing. I think people have heard that many times before. Just breathe.
It's so underestimated. It really is for
Yes.
really any stressful situation. I was just telling my daughter who's 14, she was, worried about getting some her final paper done for school, and I could see the look on her face. I was like, take a minute. Let's. She's like, I don't want to do that. That's cancer fashionista. Like, no, no, no. It really works.
Yeah.
Through the nose, out through the mouth, and
Uh,
and she noticed it. I said, if I'm going to give you one tool in life, just it sounds so simple, just to breathe, because it doesn't
mhm.
it change your it changes your it's chemical, isn't it?
It is. It's an immediate response. It activates your relaxation mechanisms. And so, yeah, when you're anxious, that's another point. You are aroused. Your body is in this kind of fight or flight mode about some perceived threat, which is uncertainty of the future. So, yeah,
Exactly.
you want to do things that would relax your body to bring that arousal down. And deep breathing, I cannot say it enough. It is the most simplest things that you can do. I think one thing that makes it not as, I guess, effective or the go-to for many people is that it's not something that is practiced. So I think of deep breathing like training for a marathon. You don't want to just jump into it when you are going to run this race or when you need it. You want to
Right.
build your endurance. You want to train your body to learn how to relax. And so as much as you can to incorporate deep breathing in your day-to-day routine, when you actually do need it, your body's already used to, oh, we're doing deep breathing now. That means we need to relax. And
This is see, I learned something new today. This is
right.
really interesting.
And
Thank you
so
for
it,
sharing.
yeah, so it doesn't feel like a chore. Do it when you would normally want to relax, when you're going to bed or when you're up in the middle of the night and you need to go back to bed. Do it then. Um,
Excellent. So before the doctor's appointment, when you're starting to feel really stressed out, simple breathing exercises and maybe
mhm.
even a little meditation, right? Like that's always great
That's
to
another
just
thing.
there's a
Absolutely.
million apps you could stick your headphones in, right?
Yes, and if your spirituality is something that's very important to you, as it is for many women and men, you want to plug into that, plug into the things that naturally ground you.
And
And
calm
so,
you.
absolutely, talking to a friend or loved one, family, just about your anxiety too, or about a non-related cancer topic, just to maybe distract you or take your mind off of
Exactly.
things in that moment. Hmm.
Great. Those are all really good coping tools. Thank you so much for sharing those.
Yeah.
Again, that's probably another topic we could really go to town on. There's so many different ways. So, but those I think are really good ones. So, what can a patient do to be prepared to talk to their doctor? You know, some patients are afraid to ask questions or forget because they're scared or overwhelmed. So maybe it's the beginning of the treatment process, and they might forget what they want to ask. And what are some pointers there?
I'd say first thing is to know that you are part of the team. Your oncologist is on your team. You're part of the team because this is your body, and you have to be part of that decision-making process, if at all possible. So you want to even come in from the standpoint that I'm partnering with my doctor. He or she really will not know what's going on with me unless I tell them, right? They ask you, how have you been, what's your pain level? So it's a partnership. It's also you paying attention to the symptoms you're having after treatment. If you're in that stage, pay attention to when the onset of your fatigue, when it gets worse, or nausea, or other symptoms that you might have. So just from the gate, you want to think of it as a partnership. And in that way, it's your, I guess, your responsibility to this partnership to ask questions and to make sure that there's communication happening back and forth. With that being said, it's helpful to always come into a visit with questions already written down.
Mm.
Talk with your family or friends about any concerns they may have so that you know to ask that to get that addressed. You may have certain things that come to mind in the moment. Keep a notebook or an index card or something and write it down in the moment or on your phone. Again, I can't stress
Exactly. Yeah, I was
the
gonna say I
technology.
I would keep a little notes on my iPhone because again with like chemo brain sometimes if you say to yourself, oh, I'll remember it the next appointment, but you
Mhm.
don't. So whether it's a piece of paper or on your phone, I think it's good to have a home base for all of your questions and to keep
Yes.
on the list. And definitely, I think it also helps to share those questions with friends and family members. So whoever's going with you to the doctor, if someone's accompanying you, so they can, if you forget, they could say, hey, what about, you forgot to ask about that.
Exactly. One other thing I would say too is that many hospitals and clinics have patient portals. Utilize those patient portals. Get yourself set up with an account so that in between visits, if something does come up where you really need to speak with your doctor, you can quickly send him or her a message. I know at where we are, physicians are very responsive to that.
Fantastic. Excellent. Well, sort of a little sidebar too, coping with uh, anxiety and fear and, dealing with your doctors and your family. There's a community of women that are living with metastatic cancer. So, again, this could probably be a whole other webinar, but
Yeah.
do you have patients that you deal with that are being treated for metastatic breast cancer, and what are some words of advice maybe for someone that was just recently diagnosed or that is, in the beginning of their treatment as
Mhm.
far as coping mechanisms?
And so you're for metastatic cancer, for so that everyone knows who may not be familiar with metastatic cancer, just simply means that the cancer has spread outside of where it originated, and the extent of that spread varies. So just because it's metastatic doesn't mean that it's kind of like the end of the line is kind of all over the place. So just want to put that out there first and foremost, and understand the goal for treatment at that point. So it may not be curative, but more so controlling the progression of the cancer, as well as, or maintaining or managing symptoms. So I think the first thing in coping is understanding what the goal is for treatment and what to expect. Um, and then asking questions around what you can do to manage that. Sometimes when in the stages of metastatic cancers, the shift may be to palliative care. And this is not end of life. This is just simply managing symptoms. A lot of things such as pain and fatigue, that's something that palliative care specialists, the physicians and other healthcare workers in that division have expertise in doing. And it's important as far as coping to go back to paying attention to your body. Log, journal about the symptoms you're having. When you're having mood changes, when you're feeling depressed, when you're feeling anxious, when you have energy, when you don't have energy, when you're experiencing the side effects, days you have sleep, because you start to see a pattern, hopefully, where you can prepare and plan ahead if you're anticipating that, okay, this is coming up, so let me make sure that I maybe plan several days worth of food so I don't have to cook because I know I'm going to be really tired, things like that.
That's really important. I think actually no matter what kind of treatment you're going through, because there ends up being a pattern of highs and lows and high energy, low energy, depression, I'm okay now. So I think that's great to just keep a sort of a record so that you then I think as a patient you start to gain a little bit of control over the
Yes.
situation. If you know, okay, I'm going through this protocol of chemotherapy, I know that based on the past couple of weeks, these next couple of days are going to be rough and I'm going to need help, or I'm going to need to stock up on groceries, or that sort of thing. So that's really good advice.
Yeah.
Thank you.
Yeah.
um, and you know I think we've covered off on so many important things here, especially just this whole webinar is really about dealing with stress and anxiety. In addition to the things that we've talked about, are there any other modalities that you suggest to your patients, like yoga, like say you can't exercise a lot, but maybe something soft, like that's not too strenuous? Or are there any other things that you recommend as far as reducing the stress and anxiety for anyone going through treatment?
Yes, there are many things that you can do. Sky is the limit, and it really just depends on your comfort level and what your limitations are. Be respectful of your body and understand that it has limitations. Listen to it. You don't want to overdo anything. With that said, yoga is great. A lot of different techniques include muscle relaxation of some kind. There's techniques that I work on with patients called progressive muscle relaxation in the moment. You can do massage therapy if you can find someone who specializes in caring for cancer patients and survivors. Stretches, kind of, it doesn't have the heading of yoga, but just a stretch here and there can always be good to wake up your muscles in your body. Exercise, light exercise that you can find, imagery as well. So when I say imagery, it's more of kind of finding a quiet space. And if you can't find a quiet space, at least just kind of give yourself the, if you are comfortable kind of closing your eyes and zoning out and just kind of taking your mind to a place where it's comfortable, it's relaxing. Maybe you're thinking about memories or places that are relaxing in general, previous vacation spots, you name it. But
So is that different from meditate? Like, what is the difference between like a guided image and meditation?
well, meditation, and that can be a whole webinar in and of itself, because people see that very differently. So even as I'm talking about meditation, someone may have a different definition of meditation. So it is getting quiet, um, and it is kind of getting to a space where you may not be thinking about anything in particular. You're just really trying to quiet your mind. So you're not intentionally imagining anything. You're really just you're really trying to zone out from anything that might pop up. And so as it pops up, you kind of maybe just bring yourself back to your current state. your current, quiet place. And meditation can be, again, different for different. Spiritually, some people have meditation as well, where they're meditating on something specific.
Okay.
So it kind of, it's a very big and broad conversation.
Another webinar. So we're coming up with all these great ideas for additional webinars. That's not a bad thing.
Yes.
um, so here's a good one. So how do you make a difficult decision in regards to treatment options? So for example, if the treatment only has a 2% success rate, what are some, if I was one of your clients and I said, there's only a 2% success rate, what are some tips as far as decision making? It can sometimes be life or death.
Mm-hmm. Well, it's hard. And whenever you're faced with something very difficult, I think it's important to always go back to what is important for you. What are your values? And when we operate in our values, we find a sense of peace. And even in operating in our values, we still have to do this cost benefit analysis. If I go this route, what will I be gaining? What will I be losing? And et cetera, for every option there is on the table, which includes no treatment, right? Some treatment or all of what's being recommended. So cost benefit analysis all the way. And does this line up with what I value? If I value longer life and I'll do whatever it takes to get it, then you kind of operate in line with what will get you there. If I operate my quality of life and I don't want to infringe on that, maybe I'm a single person, I don't have people here to support me, I need to keep going to work, I need to maintain my livelihood, and there's a lot of fear around just being able to live, that may influence your decision in what you choose to do. And these are very real things that you have to come to terms with. What are the costs and benefits? Also, going back to those goals for treatment, what are your goals? Talk with your doctor about this. Is the goal that we're after as a partnership to cure this thing, to control this thing, or to comfort me as I go through the symptoms because I'm choosing none of the above? So understand what your goals are. Be in tune with what your values are. Do a cost benefit analysis. And if you choose to, you can include a trusted loved one to be a part of your decision-making process.
Right, like a sounding board, someone that you trust, because it's not always easy to make these decisions on your own.
Yes. And it's not insulting to any physician if you choose to get a second opinion. That's something to also consider.
Absolutely. I'm a huge advocate of that, especially if it's something that's so finite. Absolutely. Great advice. Thank you for that as well. So more and more women are dealing with breast cancer and breast reconstruction. They seem to be struggling with self-esteem issues and even depression. How common is this, and when is time to get help? When is it time to, therapist, or, at what point?
This is very common. Body image issues is a very common thing when it comes to treatment. And the issues range from hair loss to changes in your skin and nails, to altered appearance of your breasts, right? Lumpectomies and mastectomies, well, mastectomies more so. And so, yeah, this is very common. And having any drastic change, whether it's internally or externally, will evoke negative emotions. So how you see yourself is just completely altered, and you have to be compassionate with yourself that you just went through something. So one of the things as far as seeking help, I'm biased. I'm going to say seek help immediately. I'm going to say seek help as soon as you from the beginning, going through it, not waiting.
It certainly can't hurt.
Yeah. But if you're questioning, okay, what is my threshold? As a psychologist, and I think any mental health provider, we're looking at understanding that things happen. Depression, depressed moods happen, anxiety happens. But to the extent that it becomes a clinical issue warranting professional attention, providers are pretty much looking at how long of a period of time without any let up that you've constantly been feeling depressed or anxious, and to what extent is it impairing your functioning, your relationships, your ability to just enjoy your life. So if you see that
Right.
you are having these symptoms consistently without any let up for, I would say, at least a week or two, if not at least, I would not at least, but at most, I'm sorry, at most 2 weeks, you definitely should seek professional help.
I totally agree with that. And I think that, no matter where you are as far as your breast reconstruction or, whether you choose to have reconstruction or not, your body's changed. And I think that, having the support of a professional is so important because as strong as you might think you are, it's an amputation. It is. So you need to, I think it's very healthy to get that kind of help to help navigate you because no one, it changes, your physical body and it has a huge emotional effect. And, I speak to women every day about it and it's very real. And anyone that's listening to this, like you said, there's never a bad time to seek help. In fact, if you even do it before you even begin the process, all the better
All the better.
all the better.
Absolutely.
Do you have any tips for pre-surgery anxiety? We had someone write into us that every time I get in the gown, I tend to freak out. That's pretty common, isn't it? I mean,
Yeah.
it's clear, for sure.
It's that classical conditioning, this neutral thing here is now associated with something negative. And so when we see that neutral thing, now it becomes negative. And so, yeah, that happens. It goes back to when anxiety, this aroused state. And so preparing yourself is also something that needs to consistently be done, working your way up to that date. So I'm going to go back to that deep breathing again.
Yep.
Also maybe having coping cards, things that remind you that you are strong and that you will get through this. Maybe having a recording for yourself. Nobody knows you better than you. And so
Wow.
I've done it where, you're
I've
in
never
this.
heard that before. You make it work like you talk yourself down and you play it for yourself.
Yes,
Hey, listen, whatever works.
right. You
I'm
start
yeah,
speaking to
hearing
yourself.
your own voice.
Exactly. It's kind of one of those questions, what would you tell your 13-year-old self? You
Oh
want
my
to
God.
you want to tell your anxious self, what, how strong you are and how much this means to you and everything, all of your reasons. You want to tell yourself all of your reasons for doing this because
Mm,
keeping kind of the end goal in mind and your values in mind gets you through some of the most difficult things.
absolutely great. I tell a lot of women that come to me and oh my gosh, my surgery's tomorrow. Oh my gosh, my first chemo is tomorrow. And you know, what I always say is, at least for me, it's sometimes shifting in perspective. Look, it's not going to change. All of a sudden, you're not going to be all, chilled out about your
Mhm.
surgery. But I always say, look at it as a bridge to your health, and it's just like you have to kind of
Yes.
walk over it, and that's it. It's hard when you're in the thick of it to see it, but I do extend that kind of advice. And, I think it's helpful sometimes even just visualizing it,
Yes.
this thing, this chemo that's going to make me so sick and so tired and so debilitating. If you look at it, that it's going to actually help, kill the cancer cells and put me in a better position than I am now, then it's a good thing. So again, it doesn't wipe all the fear away and it doesn't wipe all the symptoms away, but sometimes just shifting your perspective can at least alleviate that heavy, heavy anxiety.
Absolutely. And it kind of goes back to the goal of these things. It's not to get rid of the anxiety, it's to get you out of that stuck place of being preoccupied in the future.
Exactly, exactly. So, we have another question. Someone said they started chemo on Thursday and they're very nervous about those bad days. How would you recommend getting through those days in isolation when the side effects are too much to bear?
Mm.
Gosh, I can relate to that because I got to tell you, there's one thing. I love my doctors, but they don't always tell you about the emotional, with a capital E, side effects
Yeah.
of chemo. Oh my gosh. So
Yeah.
what are some advice that you could, especially now, I know there are a lot of women that are, I mean, it's like chemo on steroids basically because they're in quarantine. So it's
Hmm.
a whole other layer of isolation. So what are some tips for those women?
Absolutely. So, isolation is a challenge. It is a challenge, and it goes back to something I mentioned earlier about planning ahead. And that can be from meal prep. That can be from kind of organizing your space in a way that is functional when you have this low energy, when you are not in your best your best self. You're not your best self. Um, this is the time to reflect back on things that have helped you get through difficult times before. And it can be a bad breakup, it can be, uh, um, I don't know, stubbing your toe. I'm bad at giving examples for right now, but
Well,
the idea,
we get
but
it.
the idea is going back and understanding yourself. What helps you? Are you one that loves music? Because that just gets you in a good space. Well, you may want to, have a good soundtrack ready to play in the background from time to time. Um, More practically, again, moving things at a lower level because it takes energy to reach up and get plates and bowls and things on the top of your shelves, linens and things like that. So kind of organize your space in a way that is functional. Other things that you can do is to consider, granted you are in isolation, um, but help is still possible if you do have family and friends who are willing to maybe drop something off for you and leave, you know, uh, with their masks and everything. If you do have that help around, you can utilize whatever help you can get in those ways. Um, Something as simple as making sure that when you have things to be done, that you may just do them ahead of time
Hmm.
before the treatment. So yeah, you may
Right.
not get that laundry done, clean those dishes out. Again,
Right.
it's
So you're not overwhelmed. So, there's nothing worse than feeling like you can't move and you see there's all this stuff that, needs to be done.
yeah.
That creates anxiety. I think also having gone through this, and the world we live in now, I know, if I were going through treatment now and I was in isolation, I know that I would enjoy FaceTiming with my friends and family. That definitely, I think, helps you feel less alone. I know, like I've done, I know a lot of us might be zoomed out, but like the Zoom little cocktail hours with our high school group. I mean, I've actually reunited with a lot of groups of friends that I haven't, spent a lot of time with, and suddenly it's like we have these big, happy hours that we get excited about. So I think, using the digital platforms to stay connected with friends and family could be a great distraction. I also think just like, I know it sounds so simplistic, but even a great movie, right? Or a great,
Yes.
binge watching, it's a good distraction.
Absolutely. If you are able to, if you have the space to sit outside. I mean, you may not have the energy to walk around, but get fresh air. If you can't step outside, open your windows. Let that natural light in. Watching a movie, playing some of those mind puzzle games, arts and craft, just anything that is light, set yourself up. This kind of goes back to reflecting on what has worked for you. If you're one that is soothed by coloring, get your coloring book and your crayons and markers and get that ready. If you like jigsaw puzzles, whatever works for you,
Right, like if you
plan
have a
it.
hobby, right, then just
Yes,
pick it up and just get into it.
yes.
Awesome, thank you. You're amazing. I mean, like we've said, there are definitely a couple of other webinars that I think we might have to start to work on because there's so many hot topics here. That have to do with different ways to calm yourself down, whether it be meditation or guided imagery, and how to deal with isolation and how to talk to your children. So I feel like this was almost like a crash course, but I hope everyone who's listening agrees that there's so many nice little golden nuggets that you've shared with us. So we thank you for that.
You're very welcome. You're very welcome. And I can't
And then
emphasize
in
enough to
closing,
seek that help. I'm sorry, I said I
yeah,
can't emphasize enough to seek that help because this is general, but if
yeah,
you seek that help, you have
exactly.
someone who's working with you.
Yeah, I feel like we hit like there were so many things we wanted to hit, but I agree. Just that's probably the big takeaway is there's to seek help, and then we have to duplicate you somehow. Um, so in closing, and thank you once again for joining us. We definitely need to chat again. So women are losing their jobs at an unprecedented rate, and with that, they're losing their insurance. So when COVID-19 ends, there will be more women than ever before who need support with reconstructive surgery after mastectomy. The Eris Foundation, who I just adore, has been helping women before the pandemic and will need your help to help women after. Please help these women in need, and any amount is greatly appreciated. So anybody that wants to help women that are in need of this of funding for the reconstruction, you can go to the AIRS website where you can. So if you're in need, you can go to the AIRS website where you can apply for a grant and give a donation, and that's airsfoundation.org. You can also apply for a grant, and the good news is that anyone can apply for a grant, even if you have insurance. That's something that I recently learned. And on the last note, be sure to check back here on Facebook for details on our next Facebook Live event. So thank you once again, Doctor, for joining us.
Thank you so much for
And
having me.
absolutely, and I hope we have some other webinars in the pipeline for ourselves here.
Sure, absolutely.